Hello, my name is Natasha Hippolyte, and I am an EHR optimization specialist with iHealth Tech Consultant. Welcome to the How to Become a New York State Medicaid Provider and Successfully Attest within the New York Medicaid EHR Incentive Program instructional guide. As you know, it is very frustrating to begin a task when you are not exactly sure what the next step is going to be or when it will be. However, by 2015, the penalties begins with the reductions of Medicare and Medicaid reimbursements by 1%. And this is likely to increase incrementally up to 5% in the forthcoming years. Some providers are not eager with the requirement because of the time, deadlines, and most of all, the responsibility that comes with the adoption and implementation of an EMR. This is why iHealth Tech wanted to make this guide as realistic as possible with real life and real time information. In this presentation, we will be discussing three topics: how to enroll in a New York State Medicaid provider program, how to successfully register with CMS, NPES, ePaces, and MyPass, and lastly, how to successfully attest for the EHR incentive program. Okay, let's begin. It's very important that you have all of your documents in order to enroll in the New York State Medicaid program. If you don't, you will delay the process. To successfully enroll and become a New York State Medicaid provider, you will need primarily the following: an updated CV, copies of your professional degrees, copies of your medical licenses, a copy of your liability insurance, and if you have any history of malpractice, you must be able to account for them all. If you prescribe narcotics, you will need to be able to prescribe a copy of your DEA number and or a copy of your controlled substance certificate. You must be able to provide proof of your eligibility to electronically prescribe medications. If you are, let's say, a nurse practitioner, you will also need to be able to provide a copy of your collaboration physician certificate. According to New York State education law, a physician is not needed to supervise a nurse practitioner or to co-sign any of the nurse practitioner's orders, records, or charts. However, each nurse practitioner must enter into a written collaborative agreement with a physician in order to practice. Okay, now we're here at emednewyork.org. You're going to type in emedny.org. This is where you're going to find the provider enrollment. This is the provider enrollment for the physician, the provider enrollment for the nurse practitioner, the provider enrollment for the specialist, OBGYN. You'll find it all here. As you proceed to the right panel of the screen, we're going to look for example, nurse practitioner. Scroll all the way down to the bottom and you'll see it highlighted here. Once you get to that, you're going to click on nurse practitioner. It's going to take you to this site and you're going to see where it says nurse practitioner for individual billing Medicaid or nurse practitioner order, prescribe, refer, and attend only. This time, we're going to apply for individual billing Medicaid. Once you get to the actual enrollment form, you're going to see two PDF files. One PDF file is one that encloses instructions. The other one is the actual form. So if you feel that you need additional assistance in filling out the form in its entirety, then you're going to click on the instructions and download that first. And thereafter, you'll download the application. Here, how to complete the New York State Medicaid enrollment form. These are actually a list of all the things that you are going to need to fill out in this form, just in case you wanted a little bit of assistance. And basically, this will help guide you through each step. If you make mistakes once you've submitted the enrollment form to the New York State Medicaid program, this form here, which is the eMed New York Practitioner Enrollment Registration Screening Checklist, is what they're going to send you. In here, they're going to document the documents that they actually do have, and they're going to document the documents that are missing, which now will put a delay on your application. But keep in mind, the date that you sent in your application will be the date in which everything will proceed from. Even if you send in revisions, those are just your revision dates. Your date will be from the date you originally submitted your first application. Now, we're going to go to the NPES system. That is the National Plan and Provider Enumerator System. This is where all NPIs are generated from and all NPIs are registered. So basically, everything in regards to the NPI for that particular provider would be stored here. So their demographics, where they live, where they work, the NPI number, the licenses they have, all of that information would be registered here. It needs to be done immediately. Why? Because New York State Medicaid is going to check to see if the NPI is registered. If it's not, you can't move forward in beginning your attestation process. So as we move on, you're going to see I actually have the NPI registration form. So in case any of you wanted to see what the form looks like or what you're going to actually have to document in it, here it is. The application form where it's going to ask you for your credentials, the first and last name of the provider, and so on. As you continue, you'll see that it's asking for more information about the provider. This is basically the personal demographics. You're going to click next. And here you're at the business practice location address. So your business practice may not be, some people actually practice out of their home, some people actually practice out of a business location, which is either or is what you will document in this section. Here is the contact person. So as I am the designated person to complete the application and attest for the provider, my name would go in this information. Why? So that I would have access to update it for the provider at any given time. Because providers tend to want to use more of their time dedicated to their patient rather than going through the tedious effects of updating information. And this will have to be done regularly because you want to make sure that everything's updated so that in case they start checking around for credentialing and to make sure that everything is accurate and that it's still valid, you want to make sure that you have all your I's dotted and all your T's crossed, basically. Next thing you're going to do is you're going to click the checkbox. And you're only going to click here if you're sure that everything is accurate and everything has been completed. However, if you've made any mistakes, you'll be able to get back to this screen, which is the initial screen that will at least help you to view and modify any of the NPI data that you just entered. So if you made a mistake, don't worry about it. Once you click submit, doesn't mean that it's forwarded right away. You can go in and change it, and it changes in real time right then and there. However, once you log out of it, it's going to take time for it to change over again. I believe the time span is within 24 hours. Now, let's talk about this. Are you eligible? Are you eligible to apply and attest for the EHR incentive program? Well, if you want to know more about your eligibility requirements, you're going to go to www.cms.gov/regulations and guidance. Again, that's www.cms.gov/regulations and guidance. Here is basically the website that tells you all about the eligibility requirements to be considered as a participant of the EHR incentive program. Now we're here at the CMS website. This is where you're going to register and check on the status of the information that you have entered, as well as any incentive payments once you've submitted your attestation. You can check from here, and you can check from another site, which we'll talk about later on in the website. You'll click continue here. You're going to click continue again. And now we're at a site where it says warning. Don't worry, there's nothing to be alarmed about. This is just asking you to verify that you understand everything that's documented here. If you are the provider and or the person designated to complete the application or the attestation process on behalf of the provider, then you should be here filling this out. Now you're here in CMS. So basically this is the account management piece. Now, whatever user ID you've had created for NPES, which is your NPI, remember NPI, NPES, you're going to have the same user ID and password at CMS. If you change either one, both of them are still going to be the same. So just keep in mind, whatever your NPES user ID is, your CMS user ID will be the exact same. You're going to enter that information here and log in. Once you log in, you're going to have 4 tabs: home, registration, attestation, status. The one you're going to stay away from if you are attesting in the New York State Medicaid program is attestation. You will not be attesting for the New York State Medicaid program through this site. You only attest from this site if you are applying for Medicare incentive program. Okay, let's repeat that one more time. Do not click the attestation button here if you are applying for the New York State Medicaid incentive program. Let's begin. We're going to click on registration. Once we get onto the registration tab, we're going to have name, tax identifier, national provider identifier, incentive type, registration status, and action. Here you're going to have the provider's name. The tax identifier will be the provider's actual social security number. The NPI also, that will belong to the provider. The type of incentive type, as you notice, Medicaid. The registration status right now will be active. It's going to take some time. I believe it's a 24 roll around because it's going to say pending, and then once it's approved and everything has been looked over and everything is matched, when you go back and you check in it, it's going to say it's active, and then you can move forward. So here's your status information. This section here is the most important section within CMS registration. Why? Because when your check is issued, that's if everything's been approved, you've been accepted as a New York State Medicaid provider, and you successfully attested, you've now been approved for the incentive check. Woohoo! You are now going to have your check issued to you. Whatever information is documented here is where the check is going to go. So if your business address is not correct here, it won't be correct on the check. If your information is not correct here in regards to your NPI or to your TIN or to your EHR certification number, it's going to delay the process in you getting your check. So make sure that everything here is documented. I actually went through this because instead of putting the NPI for the group, we put the NPI for the actual provider because at that time we weren't aware that the group had an NPI. Neither was the provider. So we assumed that we actually had to do it under the individual provider. However, 3 providers attested, we only made the mistake the one time. So eventually, we learned from it. We didn't have to repeat it again. So this is why it's very important that I'm going to tell you, don't make the same mistake that we initially made and learn from. Registration with CMS and MPES must be completed before you apply for the electronic transmission identification number. You need the ETIN number to get into ePaces. As we move on, you're going to see more what I'm talking about. So basically here, what you see is successful registration, and this is an actual email from CMS and MPES letting me know that we have done everything successfully with CMS and MPES, and the information recorded into CMS matches that was recorded into MPES. Here, we're going to talk more about the provider electronic paper or transmitter identification number. This is an application that must be notarized. So if you don't have a notary on staff, iHealth Tech consultants, we do. So it was very easy for us to process these things very quickly because we had notaries on staff. Once the ETIN application has been submitted, it is the responsibility of the individual applying on behalf of the provider to call and verify if it has been processed. This takes about 2 weeks. Once this is completed, you will receive your ETIN number over the telephone. You'll get it by mail as well, but why wait when you can call? That's the reason why the providers don't like doing this, because they constantly have to be on top of it. Again, that's why iHealth Tech was here for our providers. Contact number is call center 1-800-343-9000. You will be asked for the NPI for the provider, the name of the provider, the relationship to the provider, if you are not the provider applying themselves, and if you are located in the same office where services are being rendered. So you basically are going to be asked these 4 questions. Just be prepared to answer it. The quicker you're able to answer it, the faster you'll get the information you need, the faster you can move on with your application process. I, for one, called every 3 days because it could proceed earlier than expected, which I was correct. Instead of it waiting the whole 2 weeks, it actually took 7 days. Here's the actual email process that starts to begin. This is what really drove me insane the first time I actually did this. I couldn't believe it. It was like email after email after email, 1 day, 2 days, 3 days later, and it was an ongoing process. But it was well worth it because everything got done in an expeditious manner. So you're going to see more emails. And basically, this is what happens when you're getting ready to go into the ePaces phase that we talked about earlier. You're going to get a user ID, and that can be utilized to enter it into ePaces. So what you're going to do is just read this email here, and this is basically it's going to guide you. So what we're doing is we're telling you the steps that you're going to actually have to take, but we want you to see how long it took and the process of communication. So it's very important that you have the correct emailing addresses so that when they send you back information, it's actually being sent back to you. Otherwise, again, that will delay the process. Here was another email where they provided me the actual user ID. ePaces is also where you will find a lot of information about MyPass. You'll find a lot of information about certification. ePaces is very, very important. Some people don't really find the significance of it, but it is very important in the attestation process. So if you want to read more about it, just go to, you can Google it. Just Google e-paces and it'll pop right up. When you are ready to attest, you will receive this in the email from MyPass. The New York State Department of Health has received your registration from the Centers for Medicare and Medicaid Services, EHR Incentive Program Registration and Attestation System, and requests that you complete the attestation process in order to participate in the New York State Medicaid Electronic Records Incentive Program. So, do you see how important that the CMS registration take place? You must complete that part so you can get to the best part ever, the part where you're getting ready to attest. So, you have to wait 24 hours prior to beginning attestation. You will need the registration ID to begin attesting. What's the registration ID? That's another email. I'm telling you, the emails. There's so many emails, you have to keep track of them. So try and create a folder inside. If you use Microsoft Outlook or if you use Lotus Notes, create a folder that's just for EHR Incentive Program. It's much easier rather than going back and forth into your emails to go to sent, to go to inbox. You can just go into that folder, move all that information into that folder, and sort it by dates. Because if you're able to do that, you'll be able to find the information you need, because again, it's all stored in your email, and you'll need to utilize it to apply and attest and to move forward with the application and the attestation process. Okay, so you really need this registration ID. Now, we're at eMed New York, and we're about to click on to MyPass. MyPass, oh my goodness, we're finally here. This is the section where you're going to start with the attestation. So, once you've clicked on this section, you will have to enter the requested information. Now, your MyPass information is the same as your ePaces information. So whatever your ePaces user ID is, that's exactly what your MyPass user ID is. Remember, your NPES and CMS is the same, your MyPass and your ePaces is the same. I know, it sounds confusing, but that's why you have iHealth Tech Consultants explain it to you. So here, once you click on the checkbox, you're going to click Submit after you've entered all the information. It's going to take you here. Remember that registration ID I was pointing out to you a few slides earlier? This is where you're going to enter it in. And then you're going to click Submit. When you click Submit and it doesn't let you through, that means that your status is still at pending in CMS. It's not at active yet. So you have to wait. You have to wait that 24-hour period. If you don't wait, you're going to keep driving yourself crazy trying to figure out why I'm not getting into the CMS registration ID portion of MyPass. So just take your time and breathe. Wait one day, and in 24 hours, your CMS registration ID will be active. And I mean it. I think I attested at 2 o'clock in the morning. The minute it became available, I was on it. Now you're here at this section, you're going to make sure that everything in this attestation piece is correct. Once you do that, you're going to click Begin Attestation. Don't worry. It gets a little easier from here because, again, in the beginning, like we told you, you have all of your information ready and you're waiting just to document it. That's it. So right now, this is important. You're required to indicate your reporting period in this section. Reporting period range in 3-month intervals, other known as 90 days. So whatever reporting period, so this is, if you look at the dates here, it says 10/1/2011, and the reporting period ended 12/29/2011. However, the payment year is for 2012. So whatever payment year you're going to be attesting for, you're always going to attest with the data from the preceding year. So if you're testing for payment year 2013, you're going to use your data from 2012. And it can be any 90-day period in 2012. during the stage 1. Stage 2 is a different story, typically the same, but asks for more information. Basically, you're just going to go by the Medicaid claims and submissions that you've had for this quarter. So we're going to look, let's say, for example, for 10/1/2011 to 12/29/2011. We're entering that information. Okay, and moving on further, we see hospital-based provider, include organization encounters, use alternative patient panel volume, standard patient volume calculation, organization NPI, Medicaid volume threshold, total Medicaid encounters, total encounters. All of this information needs to be entered accurately. Whether it's no, yes, no, actual numerical data, and accurate numerical data, the organization NPI needs to match the NPI that you have documented in the CMS. If it does not match, they are going to reject your application for attestation. So, remember, CMS is very important, NPES is very important. Make sure that all the information that you are documenting there is accurate, or it will delay the process in you actually getting approved for an incentive and payment. Inquiries made by many providers during this phase of the attestation process. The payment year is the year for which the payment is made, and the definition of first, second, third, fourth, fifth, or sixth payment years. If the EHR reporting period is CY 2013, the payment year also refers to 2013, using the patient encounters from the year preceding the payment year. Okay, so basically what this is saying, you're probably like, what was all of that? This is saying that if you are attesting for incentive payment year 2013, then you will be using your data from 2012. If you are attesting for payment year 2014, then you are going to be using your data from payment year from year 2013. Sorry about that. So basically, the payment year, you'll be providing the year before's data. I know it sounds crazy, but that's exactly what it is. So you're planning to get paid for year 2014, you need to submit the data from 2013. You planning to get paid for year 2013, you need to submit the data for 2012. So those of you who are applying for incentive payment year 2014, you need to submit your data for 2013. That's all that this section is basically saying. At this slide, you're going to have to account for any services that were rendered outside of New York. You will also have to enter the state in which those services were rendered. That's only if it's applicable. If it's not, you can just simply say no. Also, you also need to know whether or not your system has been adopted or it's in the implementation phase. Adoption meaning that you purchased it, implementation that it's installed and it's actually up and running. So you have to know the difference between the two. It's very important. The EHR certification number can actually be found on the website for the actual EMR that you're utilizing, and simply you can actually just call them ahead of time, since you know now what this section is going to be required. You can contact them and ask them what is their EHR certification number. They'll provide it to you, so when you're ready for this part, you'll have it. Better yet, you can ask them to email it to you, so that way you don't have to jot it down, lose a piece of paper. It's already in your email inside that little folder that I suggested that you create, and you'll have it ready to enter when you get to this section of attestation. It's very important that you print out the application and have the provider review it, sign it, and date it. If this form is not printed out and signed and dated by the provider, the application that you submitted online will be at a standstill. They will not move to the next phase of ensuring that everything is accurate and is complete until they receive the signature on this application. So they may have received the electronic version of the attestation. However, they will not move forward until you send in the signature portion of it. And you have to send in the entire application, not just the signature sheet. Everything has to go. And you're going to mail it right down at this number here, this address, sorry. Review and mail completed attestation packet to New York Medicaid EHR Incentive Program Administrative Support Service. Please write out the address exactly how you see it here. In this slide, we're just talking more about the payment information. So basically reiterating that if you're testing for incentive payment year 2014, you're basing that entire application on data from the preceding year, which would be 2013. Now, we've reached actually almost the end of the slide, and this is the best part. I am so happy to say this is the email that iHealth Tech consultants received on behalf of the provider stating that we have successfully attested, and let me just read it to you. The New York State Department of Health is pleased to confirm that your application for the New York State Medicaid EHR Incentive Program has been approved. A payment in the amount of $21,250 will be issued within 45 days of this notification. That was the best part of it all. So, going through all of this, yes, it's tedious. Yes, it's a lot of work. However, that's why iHealth Tech Consultants is here, and we're willing to do the legwork so that you guys can get the incentives that you need for the work and the services that you provide to the patients. In this slide, what you see is a breakdown of all the money that's going to be dispersed each year you attest and receive an incentive payment. So for example, if you attested in 2011, your first payment will be that $21,250. However, if you don't if you're not able, if you're not able to attest in 2011, but you are able to attest in 2012, you will still be eligible for that $21,250. So again, money's not lost. You'll still be able to attest for it and get it. You'll just get it at a later time. It takes about 90 days to process the attestation application. However, the day you first submit the application, if there are any errors, they do not start from a new date. They count from the day you first submitted. However, in the latter part of 2013, MyPass decided that the 90-day time frame was no longer in effect. The last provider attestation application remained in state review for over 6 months before being approved for payment, and then it took an additional 45 days to receive the payment. Yes, that last provider that we attested for 2 providers successfully where we got the funds within a 90-day time frame, but the third day, because there were so many people attesting, according to MyPass, there were so many people attesting at the same time, it was too much to get it done within a 90-day period that they had an extremely long wait list for the provider who actually successfully attested and has been approved. They couldn't get to the approval portion yet. So even if you waited all that time, think about this. You want to hope that you did everything correct. Because let's say you waited all that time thinking that everything, it's still pending. It's pending 4 months, 5 months, 6 months, and all of a sudden you get a letter saying that your attestation application has been rejected because it's missing this information. You waited 6 months to hear you're not eligible for the payment because something was missing. So that's why it's really important to do this, so that things like this that happen unexpectedly while everyone was attesting, nobody thought that the 90-day window time frame was going to go away, but it did. And when that happened, those who did not attest successfully, had to wait even longer to get an incentive payment. However, for our third provider, they got the payment the following year. So we successfully attested in 2013, and the payment year was for actually 2013, but the check didn't come until 2014. Here we are at our last slide of our presentation. What we've done at this last slide was prepare some acronyms that you are going to commonly see throughout your application process as well as your attestation phase. Please make sure you get to know each one of these acronyms. It'll make the move from step 1 to step 2 to step 3 that much easier. Again, iHealth Tech would like to thank all of you for utilizing our presentation as an instructional guide to accomplishing your task. We tried to make it as realistic as possible, and we hope that it has been useful to you at this time. We will be posting more information about attestation and other services that we are currently offering. We would appreciate any feedback regarding the services we offered or the presentation that you reviewed or presentations you will review in the near future. If you have any questions or you would like to make a comment on our website, please feel free to visit www.projectcer.com/iHealthTech. Again, that's www.projectcer.com/iHealthTech. We'd appreciate any feedback that you would like to give about our presentation, and if you need any additional services in which we can be able to offer you, feel free to contact us and we'll get back to you as soon as possible. Thanks again for listening. Bye.